Well, good afternoon, everybody, and welcome to GPA Live. I'm your host, Ron Aaron Eisenberg. Delighted to be with you. GPA Live is a virtual education series brought to you by the Global Pain Association. And today's topic and features a very special guest, inflammation and chronic pain. Dr. Charles B. Christian Jr. is our guest. He's with Inside Outside Wellness Center and Medical Spa. Today's segment is underwritten by Dr. Susan and James Blackwood, and we appreciate that. Let's welcome Susan Blackwood to our GPA Live program. She's the founder and president of the Global Pain Association. Well, Susan, thank you for underwriting today's program.
Well, thank you, Ron, for moderating and the Eisenberg Group for producing this. It's a pleasure for us to have Dr. Christian on. We've been longtime friends, and he's very, very bright. And I know he's going to be he'll have something today that everybody's interested in.
And from the standpoint of the Global Pain Association, this is just another example of the kind of information you try to bring to people who are struggling with chronic pain.
That's right, Ron. We started a few years ago to try to reach people in the community and their caregivers and help them manage their pain through alternate ways that they might be able to succeed. And these segments that we've been doing weekly give everyone time and time again some really critical elements and hints about managing their pain.
And one of the things that folks can do is get involved. You've got a brand new now, well, not so new now, support group for folks struggling with chronic pain.
We started that in January. It was launched with the Connectability folks every first and third Tuesday at 7 p.m. They can find the link on our website or on our Facebook page and join the support group. It's moderated by Dr. Marianne Pinkston, and she's amazing. She's really brought a lot to the group, and she has a little resource information each time, and then the group can network with each other and with Marianne.
And you also have an opportunity for folks who want to get involved in the Global Pain Association. They can donate their time. They can donate their money as well.
Absolutely. They go to our website, globalpain.org. There's a donate button, a volunteer button. They can sign up for our newsletter. It's just been an amazing way to reach people. We now have over 73,000 people that we've reached.
That's incredible. Now we're going to park you in the background and come back to you after Dr. Christian's presentation. And we thank you for being with us, Susan. By the way, if you are in our chat room and have an opportunity, please share this program. It extends the reach and it lets folks who you may know who are your friends on Facebook benefit from what we bring to you every week. If you're watching on the GPA Live website, the Global Pain Association website, or on Facebook, you can share this, and we encourage you to do that. I want to take a moment and introduce our very special guest, Dr. Charles B. Christian Jr. He's a graduate of the U.S. Air Force Academy, earned his medical degree from the University of Alabama. He grew up in Tuscaloosa, chairman of the Wilford Hall U.S. Air Force Medical Center Cardiothoracic Surgery Unit. He started in private practice when he left the Air Force. He's got a long interest in preventive medicine, and he's now the medical director of the Inside Outside Wellness Center and Medical Spa. And Dr. Christian, it is great to see you. Thanks for joining us on GPA Live.
Thank you, Ron, and thank you especially to Susan and James for sponsoring me and giving me this opportunity to share some of the inside-outside adventure and some of my thoughts on inflammation.
Now, you shared with me when we were talking off the air an incredible part of your experience as a heart surgeon. You were part of a team that was involved in providing new hearts to folks who desperately needed them, a transplant team, and you would go out and harvest hearts, bring them back, and participate in putting them into somebody, literally extending their life. What was that like for you?
Well, I think I'll have to say that the highlight of my surgical career was participating on that team. It certainly was a lot of work, and much of the work was done in the middle of night, so it was quite inconvenient, and I lost a lot of sleep. But it certainly was a rewarding feeling to give somebody that second chance.
Gave you a new appreciation of OBGYNs who seem to deliver babies in the middle of the night, right?
Exactly.
As you spent that time putting hearts into people. My guess is you thought a little bit about what can we do to avoid needing a new heart? What can we do to reduce the risk of type 2 diabetes? What can we do to make ourselves healthier and to stay well? And ultimately, you leave the practice of cardiac medicine to be a full-time wellness doc.
That's correct. And you bring up a very good point. And I made the observation early on that here I was operating on 40 and 50-year-old people for coronary artery bypass grafts and heart attacks and valve replacements. And you always kind of wondered what got them in trouble in the first place. And it seemed to always just go back to some kind of lifestyle choices. And on top of that, of course, is the stress that they have with their lifestyles. And I just thought it would be a more challenging thing to try to come up with a way to keep people out of the operating room rather than to figure out a new way to put a stitch in a blood vessel. So in the mid 90s, I had my first wellness adventure, the Optimal Health Partners, where I just learned about zone diet nutrition, and I was teaching that to my postoperative open heart patients. And that's evolved now into what we call the Inside Outside Wellness Center and Medical Spa. And I'm the medical director of the spa. And we're trying just to help people age successfully. And we've got some strategies, I think, that are proven strategies. They work. And you don't waste any time, money, or energy with these strategies.
Well, let's talk a little bit about that because I know one of the things that you touch on is the challenge that folks have with unresolved inflammation, which is a common burden we all carry. And apparently, it's at the root of many chronic diseases. Inflammation means what?
Inflammation is a good thing. I mean, when the COVID goes after us, we want our inflammatory immune system to go into high gear, and it's actually a pretty robust response. Our immune system inflammatory process has a capability of actually liquefying or turning to pus any organ or either cause scarring in that organ. So inflammation is a good thing, but the thing about inflammation is you want it to stop without any kind of organ damage or permanent damage. One way you can tell that you have silent inflammation in your body is some lab work. Probably the most common thing that's done is item number 2, the high sensitivity C-reactive protein. This is a nonspecific indicator of inflammation in your body. But Dr. Barry Sears, the founder of the Zone, thinks there's probably 2 other tests that could be done. And many of your private doctors, family doctors, are doing the omega-3 index testing in their offices as part of your yearly lab work. But we know that most chronic with elevated obesity markers. Chronic pain patients will have elevated markers also. So it just follows that inflammation is going to make chronic pain worse. And if you have flares of inflammation, then you're going to have flares of your chronic pain.
Now, aside from those medical tests, lab tests, are there ways you can tell if you have inflammation?
Well, I think the best way, of course, is the testing. Now, if you've got some kind of chronic disease, as we just mentioned in the last slide, you do have low-grade infection in your body. And that infection can come from a number of sources. And I would like to emphasize today 3 barriers that we do have breakdown in our body that allow our bodies to develop chronic low-grade inflammation that then causes and exacerbates chronic pain syndromes. And one of these gut barriers is your gut barrier. Many people have heard about the leaky gut, where you lose your protective mucus layer. The bacteria, the microbiome, gets all confused and some of it dies off, and it makes your GI tract vulnerable to absorbing endotoxins from the bacteria, and food particles that then cause inflammation in your body. And an anti-inflammatory diet and other things are going to help you with that. Another barrier that we want to try to really keep healthy is your cell membrane barrier. And the thing that makes a cell membrane structure proper is the types and amounts of fats that are in that cell membrane. And you want 8 to 12% of that fat to be the omega-3s, EPA and DHA, and that's what we call the omega-3 index. So if you fix a cell membrane by its structure properly, just like if you fix the gut membrane, those structures are going to act as the barriers that they're supposed to do. Now, the omega-6s are essential fatty acids, as are the omega-3s, essential fatty acids. In other words, you have to eat them in our diet. But we've been eating a little too much over the years of the omega-6s. They're converted into a molecule called arachidonic acid, which is the precursor to all kinds of inflammatory markers in our bloodstream that initiate inflammation. On the other side, the omega-3s, they're converted into what we call pro-resolving mediators that help to resolve inflammation without any kind of structure or function damage. And of course, I mentioned we could actually measure these ratios and also the EPA plus DHA or the omega-3 index.
Now, a lot of that omega-3 we can get from fish.
Exactly. But it's been shown that Americans won't eat the same amount of fish that you see with Japanese or Alaskans or people up in Greenland. So to get enough omega-3 in our diet, most of us are going to have to supplement with omega-3 products. And if you want to really determine whether those omega-3 levels are adequate or not, this is the testing that you can do. You can go to OmegaQuant, Google it, just OmegaQuant, and this omega-3 index test is just a simple blood test that will tell you how much omega-3 you have in your cell membranes. And based on that information, you can then increase your intake to levels that we think are helpful to help resolve inflammation.
Now, I have a question on this slide. You say find out with 1 drop of blood or milk.
Yes, milk. Well, it turns out one of the important omega-3s in breast milk is DHA, and that's one of the 2 omega-3s that you find in fish oil. So the amount of these omegas that are in mother's milk to a large extent determines some of the health of your child when it's born. In many countries like Japan, the mother's milk is high in omega-3s, and it's been shown that these Asian children have better IQs and they do better in school. We've all kind of observed that compared to the milk of American mothers. And they're actually putting omega-3s in prenatal vitamins now, and they're also putting omega-3s in baby formula.
Now, when you talk about supplementing with an omega-3, how do you know you're getting a supplement that's really going to work? Because FDA doesn't regulate supplements as they do other medicines.
Well, that's an important point. And Dr. Sears, the founder of the Zone Diet, really emphasizes the purity of a fish oil product. There are 2 organizations that actually will evaluate omega-3s, and each of the products that I recommend have gone through these evaluations and are considered what they call 5-star products.
So what do you recommend?
Purity. Well, the life extension products, they've been around for quite a while. They're very reasonable, and their omega-3 product, the kinds of omega-3s come from 3 different sources. You have a triglyceride source, a phospholipid source, and the krill oil source. They're all in that life extension product. Now, Dr. Sears has got his own fish oil. That's probably the purest on the market. It's just got the EPA and DHA in it, and it's a little pricier.
Now, you had mentioned to me you'd mentioned me off the air, and sorry for interrupting, that you eat a lot of fish and mostly salmon, right?
That's what I do. Yeah, exactly. Yeah. It's just so convenient. HEB's created these simple meals, and it's just a perfect size of a salmon steak with their little simple meals.
And you get omega-3 through that.
Exactly. Yeah. Again, you're
Now,
not
tell
going
me,
to get enough on a daily basis without supplementation.
we've got some more information here about Barry Sears.
Wow, exactly. He's one of my heroes. I met him in the mid 90s after he'd written his first book, and he introduced me to omega 3s and his zone diet. And he wrote several books. He's probably been the most prolific author trying to indicate to the public the seriousness of low grade chronic inflammation. In fact, his newest book, The Resolution Zone, talks about the fact that we've discovered in the last 2 years omega 3s are used to resolve inflammation. In fact, he actually describes wellness as the absence of silent inflammation. And he's predicted in that one quote, dietary control of resolution response may have a far greater impact on the future of medicine than genetic engineering.
Wow.
So, yes, exactly. And those are pretty catchy titles, aren't they? Toxic fat, anti-inflammation zone, showing about the power of food to reduce inflammation in your body by
Well,
eating
what kind of diet do you follow?
well, I follow what I call a modified zone protocol. Um, I've actually increased the protein in the diet that I recommend to clients simply to facilitate their strength training. And the fact that as you age, it's been shown that you need more protein. Uh, in the aging process, we have what's called a blunted response to feeding, and that can be overcome to some extent by taking in some extra protein. So my diet is a little higher protein than the usual zone diet.
And what are you getting the protein from? Because I don't think you eat a lot of red meat.
No, I don't. I get most of it from uh, different animal sources, like fish and chicken primarily, and we'll rarely have red meat. But I won't turn out a good steak on my birthday or something like that, or on Father's Day. That's for sure. And of course, the other aspect of the kinds of protein would be the kinds of fats. And of course, in the Mediterranean zone kind of program, most of the fat calories would be coming from olive oil sources. And again, tending to limit the amount of saturated fat you have in your diet from the red meat and things like that.
And
And of course,
olive oil is a good oil.
it's what's called a neutral oil. Yes, uh, it doesn't produce any inflammatory molecules like the omega sixes, and it's used for calories, and it forms a constituent of the cell membrane. It's a very neutral fat.
So it gives great support for having a martini with an olive.
That sounds like a good use for olive oil. Exactly.
Now, I don't want to miss something that you said. You slipped in weight training, and I understand that's something that you really believe in, especially for older people.
Exactly. I personally don't think that there's a single better anti-aging strategy than strength training. We know that as we age, we're going to naturally lose strength and muscle, but um, the thing to do, of course, is strength training to try to maintain your strength and muscle mass as you age. As you lose both of those, you lose what we call activities of daily living, just your ability to take care of yourself, to feed yourself, to walk upstairs, to buy groceries, get in and out of a car. You see, losing strength muscle mass ends up eventually into what's called the frailty syndrome. Whereas you just get older, you get weaker, you end up in a wheelchair, assisted living home. Then you go to a nursing home, you try to get out of bed one day, you go to the bathroom, you slip, you fall, you break something, and you die. That's called a frailty death. And if something like that's avoidable, then I think you ought to go for it. And strength training is the one thing that can reverse that. And it's a big topic now in the gerontology literature is exercise prescriptions for seniors to rebuild their strength.
Now, this is a picture on screen of the facility at your inside outside gym.
Exactly, exactly. We don't have any aerobic equipment in there, but the protocol involves a circuit weight training uh, protocol where you go from machine to machine to machine, ideally with very little rest. So you do get yourself a little bit of a rate elevation. I've actually measured my heart rate at 156 beats per minute after just 6 machines.
Wow.
So if you do this intensely, you can get a very robust heart rate response, which gives your
Now,
body some degree of what we call metabolic conditioning.
now how does 150 so heartbeats compare to your resting heartbeat?
Well, my resting heartbeat is in the low 60s at this point. So I think on that one workout where I recorded that, I was a little hyped up for the workout because we did make a little video of it on YouTube, my little 6 minute workout. But we started at I think at 86 and went to 156 in 6 minutes.
Now, at Inside Outside, what is your focus for people who want to participate?
Well, we're talking about inside and outside strategies. The inside strategies involve our nutrition and strength training advice and protocols. The outside strategies are about aesthetic things like Botox and chemical peels and microdermabrasions, things like that. So we're kind of and good skincare products. So the nutrition and exercise strategies involve some variation of zone paleo nutrition plus the strength training. So we try to create a process by which people can come in and get educated about their nutrition, and then we put them in this exercise program. And ideally, they'd be coming in twice a week to do workouts, but our strongest clients only come in once a week.
And where is it located?
It's in Methodist Plaza, adjacent to Methodist Hospital. Been in this building for 35 years now.
Wow. Now, tell me a little bit about how your grandmother was ahead of everybody in understanding inflammation, omega-3, eating well.
Absolutely. Well, I had a special grandmother, like most of us have, I'm sure, special grandmothers. And I grew up with my mother and my sister and my grandmother. And my mother worked, so I was kind of taking care of my grandmother. And she did all the cooking. And at the dining room table, she'd say, "Charlie, eat that meat." And it was either baked ham or baked chicken. I don't remember eating much fish growing up. And then she'd say, "Eat those vegetables." And she grew that stuff in the backyard, all of it, except for corn. Every now and then she'd go to Piggly Wiggly and she'd get some corn and she'd shave it off and fry it up. And we had cornbread, but we didn't have white bread or biscuits or potatoes or rice or pasta. And then after the eat the vegetables and eat that meat, she'd say, "Here, gag down this cod liver oil. You are one puny kid." And I think she'd seen an advertisement from the 1917 Texas Medical Journal that was entitled "Cod Liver Oil for Puny Children." And to tell you the truth, I was 5'10", 120 pounds. Somehow got into the Air Force Academy with a waiver from the Surgeon General. I was so skinny, and was the skinniest kid at the academy. So anyway, there was a big push about 60 years ago for mothers to give their kids this tablespoon of cod liver oil. And Dr. Sears is fond of saying the biggest mistake in the last 30 years is when we stopped giving our kids a tablespoon of cod liver oil every day.
Now, what was cod liver oil? I remember it as a kid, although we didn't use it.
Well, it's from the liver of a cod, and it contains omega-3s plus some vitamin A.
Oh, so it actually came from a fish.
Yep.
I never knew that.
Yep.
So your grandma was giving you omega-3 before anybody understood why.
And the right kinds of lean meat, the chicken and the ham, and of course all the vegetables. Exactly. So she was doing a Mediterranean zone diet. I can't remember much olive oil, and I don't remember the martinis, but yep, she was ahead of her time.
All right. Now, before we let you go, what have we not asked you that you'd like to share with our GPA Live viewers?
Well, I guess one thing is I didn't mention the skin barrier. we have a pretty large organ. It's called our skin. And that barrier gets messed up as we age also. And it can be a source of chronic inflammation in our body because the thing that constructs us of the skin barrier are the fats that are in the skin barrier. And as we age, we can strip all those fats very easily by using harsh soaps and detergents in the shower. So a general recommendation from a lot of dermatologists is to not use harsh soaps in the shower, just use water. And afterwards, use some kind of product that contains one of the fats, which is called ceramide. So you can Google ceramide moisturizers, and there are a number of them out there that you can apply in the shower and then just towel off after the shower. So that would be the other barrier that we didn't talk about that I want to make people aware of. It's a big source of inflammation.
Now, for folks who are on blood thinners, there's a lot of bruising, certainly for the arms and hands and legs.
Well, that is bruising is related to the fragility of that skin barrier. Exactly. The skin is very thin in those areas that are bruised. You've probably seen it on older people. Skin's very thin. It's lost all of its protective characteristics. So you're right there.
It's almost see-through skin.
Exactly. Yeah. So that's another reason to focus on keeping that skin barrier intact.
So the ceramide lotion will help.
Yeah, plus not stripping those oils with the harsh soaps. Exactly.
Now, for folks who want to get, I'm sorry, go ahead.
I'm going to say there are some, fairly expensive barrier restoration products out there that could be used on small areas where your barrier has broken down. Like people when they have rosacea on their face and the skin is thin and red and irritated, that's a barrier dysfunction right there. So you could use a more expensive, a triple lipid product, for instance, that restores cholesterol, fatty acids, and ceramides to the skin.
Now, if one went to see you at Inside Outside, you can make those recommendations?
Exactly. Yeah. Yeah.
Now, how do folks get a hold of you?
Well,
I see on the screen a phone number.
There's a phone number. And we do free consultations for our wellness program. So if a person's interested in the strength training or maybe just the nutrition part, we have a DEXA scanner, which is used for bone density testing, but it also measures body composition. So a lot of our clients come in and we do the body composition scan, and on the basis of their body fat percentage, we create a nutrition prescription that tells them exactly, how many calories and so forth to help them lose fat and ideally gain a little bit of muscle. So,
well, Dr. Christian, I want to thank you so much for coming on with us today. And again, for folks who want to get a hold of him and visit Inside Outside Wellness Center and Medical Spa, 210-616-0836 is the phone number. And Charles, thank you. Appreciate you being here.
You're welcome. It's been an honor.
Well, you have a great day. And we're going to welcome back to our GPA Live platform, Dr. Susan Blackwood, who is the president and founder of the Global Pain Association. And we want to talk with her a little bit about whether or not you're running out to buy some of that skin stuff.
Absolutely. I've been a firm believer of the things that Dr. Christian promotes and been a follower of his for quite some time. And I knew this is going to be a really important segment, and I'm really pleased that he was able to join us today.
Well, talk to us about how people can get involved with the Global Pain Association.
Well, Ron, we want to keep this series going. Our board has voted to have another series starting in June. This is our first one, and going through the summer months until we might be able to have another in-person event like we did in 2019, which was very successful. But again, we can't continue this series or do very much about promoting even the support group without donations. And people can go to our website, www.globalpain.org/donate. No donations too small. We appreciate all that we can get. We put those donors on our website so people know who's really supported this organization.
And you'd also like to hear from people about potential topics they'd like to see covered on GPA
Absolutely.
Live.
Yeah, they can go to our info@globalpain.org and just jot down some things that they would like us to cover. We really appreciate people that have been sharing things on our screen today, and we'll be back with them and give them some feedback too.
Well, Susan, thank you very much. Appreciate it. Coming up next Saturday, June 12th at noon, right here on GPA Live, our topic is advancements in treatment for lower back pain. Dr. Mei Lau with the Advanced Spine and Pain Center will be our very special guest, and we certainly hope you can join us. Have a great weekend, everybody. I'm Ron Aaron Eisenberg, delighted to host this program. Thank you to the GPA Board of Directors, and thank you to our executive producer, my wife, Gina Galaviz Eisenberg, for making all this possible. We'll see you next week on GPA Live.